Influenza is a contagious and potentially life-threatening respiratory illness occurring every year. When a new influenza virus emerges, it can lead to a pandemic, infecting large populations with often devastating consequences. Although unpredictable and occurring infrequently, influenza pandemics have caused a large number of deaths and created socio-economic disruption in the past. In 2011, stakeholders and the World Health Organization jointly established the Pandemic Influenza Preparedness Framework, or PIP framework. Its objective is to improve preparedness and response for the next influenza pandemic. The PIP framework brings together WHO member states, industry, other stakeholders, and WHO to implement a global approach for pandemic response that is rapid, flexible, effective, and equitable. The framework is built on three fundamental pillars: virus sharing, benefit sharing, and governance. Within the region, 10 countries are beneficiary countries of the PIP partnership contribution. WHO supports member states of the region to establish functional Sentinel ILI/SARI systems and epidemiological surveillance, laboratories, health systems and health professionals, emergency response systems, and risk communications capabilities. Since the initiation of PIP support in 2014, significant improvements have been witnessed in those priority countries when it comes to influenza surveillance, pandemic preparedness, and response systems and capacities. Most priority countries have PIP-supported laboratories and trained human resources, and as a result, have been able to respond effectively to the COVID-19 pandemic. As of 2021, 19 out of the 22 countries and territories of the region have a functioning Sentinel influenza-like illness and severe acute respiratory infections surveillance system, while 18 designated national influenza centers and 4 national influenza laboratories are operational with the ability to detect and confirm unusual influenza viruses with human pandemic potential. The PIP framework represents an important measure in safeguarding populations against the impact of future viral respiratory virus pandemics. Although a lot has been achieved within the region, more is needed in terms of implementing the framework. The world must remain vigilant for influenza viruses with pandemic potential, as they can emerge anywhere, at any time, with little warning.